Hi, I'm Rajana, and I will be presenting about the effects of education on community health. So first, a little bit about me. I'm a senior at Lynbrook High School in San Jose, California. Some of my extracurriculars are that I'm a founder of the nonprofit Hands on STEM, which strives to close the education gap by providing experimental STEM opportunities to low-income students. I have also been tutoring and guiding student refugees for the past 4 years through a club at my high school called Paper Airplanes. As I became more aware of mental health, I started interning at a nonprofit, Mangata Foundation, led by a professor at Stanford. Here, I conduct research on how different demographics view mental health illness, and I have also formed effective virtual support groups for teens of different cultural groups. I am also on the Youth Advisory Group for Mental Health for Santa Clara County, and I advocate for improving mental health curriculum at local high schools. I love to play the violin, and I have been playing for almost a decade now. Aside from my work, I love to learn new dances, play with my dog, and listen to music. My main interests are in sociology, science, medicine, and I hope to pursue medicine in the future as an oncologist. Now let's move on to the more interesting part of the presentation. In many countries, including the US, living in low-income communities equals getting a low-quality public education. This problem affects many factors of a person, including their mental health, physical health, cognitive ability, and even the overall crime rate of a community. If countries provide high-quality education for all communities, the welfare of many low-income people will be improved. So how is education even related to global health? Let me take you through a scenario. When one enters a public school with low funding and a shortage of resources, they also miss out on a ton of educational opportunities and most likely do not have the awareness about the importance of higher education. Due to minimal schooling, students are forced to work multiple minimum wage jobs with little to no amount of health coverage. As the cycle continues, they can only afford living in neighborhoods with poor living conditions, encountering extremely stressful situations every day. These poor communities also have a very small influence on policymaking to actually make changes in their communities. Living in a high-stress area with poor infrastructure and no healthy food options affects a person's health. Studies show that impoverished people have higher risk of obesity, diabetes, and heart-related disease. The achievement gap can be defined as observed persistent disparities in education performance between subgroups of students. My public schools is one of the top schools in the country, and it provides countless opportunities, especially for STEM, and many students are able to take advantage of AP classes, tutoring, STEM clubs, and science fair. However, just 20 minutes away, there are public schools with barely enough textbooks, let alone lab materials or opportunities available, and many students struggle academically. Many of the students who attend these schools are from low-income families and are by POC. This is an example of the achievement gap. Some of the causes of the achievement gap are that schools for low-income students get less funding from the government due to poor test scores, have underqualified teachers, and no reinforced opportunities for students. The graph shown here illustrates the achievement gap between low-income fourth grade students and students of different races. As you can see, the children who are most negatively impacted by the achievement gap are by POC or low income. The effect of the education gap ranges far beyond grades and test scores. Mental health is greatly impacted as well. And education is not only to learn specific subjects, but also helps children build a resilient mindset, and educated children have more exposure to coping strategies. In a safe classroom, students can learn and practice perseverance, self-control, anger management, and many other qualities that are crucial in adulthood. Students with a minimal amount of education have no safe space to learn social skills and are not aware of healthy coping strategies. A better education also leads to high or paying jobs, which puts people in few higher stress situations and can alleviate hardships such as economical hardships and violence. Data from a study conducted by Dartmouth shows that the prevalence of depression in third world countries is about 2 to 6 times the amount as it is in North America and Europe. North America and Europe have a better public education system overall compared to many developing countries. So a bigger percentage of people are able to not only experience upward social mobility due to having a better education, but also learn important social skills for their adult life. Similarly, when schools are inadequate, dropout rates are higher. Without a high school education, a sense of direction, and a small amount of jobs available, youth are driven to gangs, where they can find a sense of belonging. An accumulation of gangs increases the crime rate of poor communities, contributing to childhood trauma and negatively impacts the overall mental health of the community. Living in high-stress areas with higher crime rates, poor infrastructure, and discrimination means that inhabitants of these communities generally have higher levels of cortisol. Abnormally higher levels of cortisol can increase risk of obesity, high blood pressure, and intestinal problems, heart disease, and can even lead to compromised cognitive ability. Furthermore, minority and low-income dominated communities have less awareness about the importance of health due to insufficient levels of education and do not have the time or money to invest in their health. Low-income neighborhoods have 2.5 times more exposure to fast food because franchises want to capitalize on the need for fast, cheap, and convenient food. There's also less access to affordable, healthy food options. These factors result in an increased rate of obesity and malnutrition in poor communities. In addition to the factors discussed above, many minority students face discrimination at school, which may affect their academic performance. The most common form of discrimination at school is racial implicit bias, which are decisions made in an unconscious manner, which shows a person's attitude or reinforces stereotypes. According to a Yale Child Studies Center project done in 2016, when asked to observe which children had behavior problems, teachers focused more on Black children than white children. In another experiment, when teachers were asked to suggest a punishment for a child who was acting out, there was an increase in the severity of punishment when the race of the teacher did not match the child. Many minority students might develop chronic stress when they encounter racism frequently. As stress occupies the student's brain, it lowers their performing ability in the classroom. You might ask, what can high schoolers do to ensure that all communities get equal opportunities in terms of education? One way is to help close the opportunity gap and raise awareness about the discrimination in education systems through hands-on STEM. This opportunity is a great way to gain leadership experience, make social change, and accumulate PVSA certified volunteer hours. Students of all skill sets and levels are welcome, and it is a truly great opportunity to make actual social change. Students can email the email I will give later in the presentation if you're interested. Here are a few of the wonderful and informative citations I use to create my presentation. Thank you for listening. Here's my email if you have any questions and the Instagram for our nonprofit, Hands on STEM. I hope you learned something new.